Olá, meu nome é Sidney Klajner, sou cirurgião do aparelho digestivo, presidente do Einstein e membro do Board de Diretores do Institute for Healthcare Improvement. Nos últimos dias, o Einstein sediou a 9ª edição do Fórum Latino-Americano de Qualidade e Segurança na Saúde, o maior evento para debater o tema na região, em parceria com o IHI, o Institute for Healthcare Improvement. O tema central das discussões este ano foi a tecnologia em busca da equidade, um debate crucial em todo o mundo, mas especialmente onde as desigualdades econômicas e sociais apresentam desafios complexos no acesso à saúde, como no Brasil e nos nossos vizinhos. Usar os avanços da tecnologia para superar essas barreiras e oferecer atendimento de qualidade onde quer que o paciente se encontre está no centro das ações do Einstein para transformar a saúde no Brasil. E durante o fórum, nós discutimos com parceiros de diversos países como podemos fazer mais para promover a equidade em saúde em todo o mundo. E é com um enorme prazer que eu recebo aqui, agora, o Dr. Amar Shah, psiquiatra forense e diretor clínico nacional para a melhoria do NHS England, o Sistema Público de Saúde da Inglaterra, que também foi parte de inspiração para o nosso SUS, para conversar um pouco sobre os desafios em promover melhorias na saúde em diferentes países e sobre qualidade e segurança na saúde. Bem-vindo, Amar. Welcome, my friend Amar.
Obrigado.
Amar, it is crucial to plunge into the debate on quality and safety in health around the world, even if realities between countries differ tremendously. You are now the National Clinical Director for Improvement in the NHS UK. What are the main challenges you perceive when we talk about quality and safety in English public system, and how does it differ on resemble obstacles found in other countries?
Sydney, in some ways, the challenges are very similar. In other ways, I think they're quite different because in England, our main challenges are around access to care, making sure people have access when they need it, about trying to make sure that as a publicly funded system, we're able to deliver all of the care that we need to within the resource we have available. And at the moment, that's a very big challenge for us. And also to make sure that people are happy with the outcomes and the experience of the care they're delivering. And I think some of those are similar, although the context is going to be very different in different parts of the world. But all of us have to really understand what matters to our local people and our local communities and make sure we're delivering that, particularly in public funded systems where we are relying on tax dollars and the government support to be able to provide the best possible care we can within a certain amount of resource. I think, the answers and the solutions are there. That's the hope we have to hold on to, because although in the NHS it's a big system, actually for most of those challenges we have solutions. They're just not scaled and consistently applied. So that our big challenge is to really learn what's working and figure out how to help others adopt those changes everywhere.
And engage other people that work together.
That's the only way to do it, isn't it?
Yes.
Yeah.
Yes. Understand and agree at all.
Absolutely. Yeah.
So another one, quality and safety are priority for us here at Einstein. For decades, we have been concerned with incorporating global references into our practice. And the results of this area reflected in numbers. For example, 99% of the patients admitted to the hospital with acute myocardial infarction or heart failure say they are satisfied or very satisfied with their treatment result. We also have low reported rates of preventable complications and high reported quality of life for patients after surgery or treatment. In your view, what are the main challenges for us to replicate and scale these to further promote quality and safety in health around the world, not only in our environment?
I think the first thing to think about is, do we know how we achieve those results? And I think if we apply really rigorous scientific methods, we'll have a better understanding of the things we've done differently that have led to those results. Because unless you really understand that and you can standardize it and document it, it's hard for others to adopt in other places. I think the other thing to really think about is how do we sustain that improvement over time. It's probably one of the hardest bits of improvement is to not improve the system, but to hold on to that and to continue to try to get better and better. That's a big challenge for us, even before we think about taking it to other places. I think even when you have outstanding results like the ones you've just told us, there's still variation. There's still going to be variation between clinics and between hospitals. So are we really paying attention to that and trying to make sure there's no unwarranted variation? When we've done those things, we're probably in a place where we can say, right now, let me help see if we can take this learning to other places. And I found that, being able to tell the stories with people's own words and their own emotions is perhaps the most powerful way to convince other people. Because nobody wants to take an idea from someone else, right? It's much easier to come up with your own ideas. But I think the power is in really understanding the impact it's had on people and then understanding what you can do differently in your practice and have a way to measure it and see whether it leads to the same improvement. But to do that, we have to bring communities together around something they all care about. And that's what really community activism is about. It's about creating that urgency around something that we know could be better and then helping people see how they can get there.
It's not only about the efficiency of the treatment, but the experience the patient has in our environment.
Absolutely.
And it's the balance from expectations to results.
The balance is the important bit, right? It's easy to just improve one aspect of quality. The trick is to get the balance right between improving lives, the health of people, the quality of care, and the cost of care. When you can get the balance right and do that in an equitable way, that's the goal for us all that we should be working to.
The safe treatment to everyone.
Absolutely.
So, Amar, in an article that we read, you said that improvement is a word linked to optimism and that it conveys an idea of always moving forward. I agree. But in practical terms, what are we talking about when you think about health improvements? And what is the role of health organizations and health professionals?
When I think of health improvement, actually, I think of two emotions. I mean, one is the joy that you can experience when you actually find a way to change the system you work in, that sense that you have a bit of control, that you're not helpless. And when you see other people experience that, there is a real joy in that as a leader. But there's another side to improvement, which is it's really hard work. It needs a lot of persistence and grit and determination and courage. And that's the bit we often don't see, we don't pay attention to. And I think as leaders of health systems, we've got a responsibility to think, what is the best way to deliver high quality outcomes? What's my mental model about that? And if I really do believe in improvement, I have to figure out how to support people through both of those very wide fluctuating emotions that come in this work, because the potential is great, but actually we have to support people because it's hard work. And often it doesn't work. There's a lot of failure before we see a success. And so we have to really prepare people for that long road. And I think it needs that constancy of purpose that you have here at Einstein. It's visible. The journey you've been on for many, many years, it needs that constancy. It needs the leadership to continually reinforce that the solutions are going to come from the patients and from the people working close to the patients, and that we're here to give you the support and the environment in which you can make things better. But that takes many years and much courage to get there.
Many years, and we rely in some partnerships. One of them with IHI and you, because I remember many years ago in the same event how I could learn with other experience like NHS, like your participation also.
It's a privilege, I think. For me to come here and to learn from you is a privilege. It's hard to do because we're all busy, but I think if there's one thing we should all be doing more of, it's going to learn from others, because there's so much richness in that.
So that I was in London in April.
Yes, exactly, yes.
What about the patients? What is their role in health improvement actions?
Well, we're doing this for them, aren't we? So how can we possibly improve the system without them being right at the heart of it? I think we always knew in my own work, in my organization, that it was the right thing to do, but I don't think we ever understood quite how important it was. Only 5 years into our improvement journey, we looked backwards and we saw that the pieces of work where patients had been really, truly involved in co-designing the improvement work, it was 3 times more likely to be successful than our other improvement work. I don't know that that finding has been replicated anywhere else in the world, but for us it was so stark. But it's difficult to do. It's not always easy, and we've had to experiment and learn what is the best way, the most meaningful way to involve patients and their family members in improving the system. Not everyone is ready to do that. Not everybody wants to do that. It takes some time to change the power balance between the caregivers and the care receivers, and to learn how to listen and respect people's opinions and views that are different to yours. It's difficult work, but the reward can be a much better understanding of the system, new ideas, and actually patients can bring urgency to this work. Just like the Julia Lima Awards have done for you. You know, they bring something very different that is hard for us to replicate. That, the altruism that we see from patients in wanting to make the system better for others. It's hard to not make that create some urgency and desire in yourself to do better.
Here in Einstein, we had the opportunity to bring patients to consults based upon a specialty or what they survived about, for example, for oncology, elderly. But when we try to select patients, there were, for example, 200 patients wanting to be in one of the 30 space of the consult. So the patients want to participate, I think, to get the system better.
Oh, I think they do, and I think that's an amazing asset for us, isn't it? That people want to give back and make the experience better for others. We would be foolish not to invite them.
So, considering realities, they are unequal as those we see in Brazil and other countries and other parts of the world, where there is often a lack of basic items for care or even doctors and other health professionals. Where should we start when thinking about improvement? What method or protocols are there for this, or they are not there for this?
They're there, but in some ways we have forgotten to use them, right? So I think the first thing is to use our eyes and to use our ears. If we just look and if we listen hard enough, we will find where the inequities are. It's there, it's obvious, it's glaring. We just haven't looked and listened hard enough. And when we find them, it is easy to get paralyzed because they are so stark and they feel impossible to tackle. Sometimes we assume they're structural, so that I don't have power to change this whole system. But actually, we need to then listen. We need to go and we need to sit alongside and we need to listen. Sometimes we need to walk the journey and we need to understand what matters to people. And we might be surprised that actually what we're trying to do doesn't really matter the most for them. What they really care about is something else. And we need to learn, where do they go and get their trusted counsel and support from in the community? Because it may not be the healthcare system. It might be the church. It might be the synagogue. It might be the local sports group. We need to go and look and learn and listen and actually take steps. You know, this is hard work, but you could easily get paralyzed in finding the perfect solution. Just start. Start somewhere, partner, build bridges, but do it with rather than for.
As we heard this morning, start with starting.
Yes.
Yes.
Control what you can control and start.
And remain motivated.
Yes.
Because I think it's crucial to our work.
Yeah.
Thank you, Amar. I know you have a keynote to prepare. I will be there. Thank you for your participation. Agradeço ao Amar por essa discussão tão importante. Agradeço também a você que nos acompanhou até aqui e assista às demais conversas que gravamos durante a 9ª edição do Fórum Latino-Americano de Qualidade e Segurança na Saúde, na playlist dedicada ao tema aqui no canal do Einstein no YouTube. Um abraço a cada um de vocês.